Viewers, I'm going to put the spotlight on COVID now. And I'm going to talk about one state that now seems to be the big laggard, that is actually responsible for almost half the cases which are currently being reported in our country. Kerala, the state where we first saw COVID cases when people travel from Wuhan, students travel back from Wuhan, the state that has actually managed to many times get a good control on its COVID cases, then opened up its shops, opened up, loosened the guidelines, lifted the lockdown violations, and still managed to keep a control. But something seems to be going wrong now. Kerala now is one of the worst affected states, with 5,980 cases reported in the last 24 hours. Assuring that the transmission rate has come down, Chief Minister Pinarayi Vijayan said that the government is planning to increase the testing to 1 lakh per day. Now, according to the Chief Minister, over 80,000 samples were tested in the last 24 hours. Number of RT-PCR tests have also been increased. So, obviously, the government is very well aware of the fact that this has become a big challenge for a state that is also heading into elections. Kerala model was supposed to be one of the best models in terms of tracking, surveillance, isolation, and testing. And so, even though they lifted some of the lockdown rules earlier than other states, they managed to keep a control on this. But that's not happened now. At a time when even states like Delhi are showing a fall in cases, at a time where Delhi, in fact, just recently didn't even see a single death in a day. And that's the kind of statistics we are looking at in all the other states. It's Kerala that seems to be having over 50% of our cases. Look at that. So we're going to try and understand what's gone on here. Let me say good evening to Jeremy Thomas, journalist with Malayalam Manorama, joining us this evening. Dr. Padmanabha Shenoy joins us this evening, an immunologist and a rheumatologist. Thank you so much for being with us. And A.N. Shamsheed, member of the Kerala Legislative Assembly, joins us this evening of the CPIM. George Kurian of the BJP with us this evening. Let me actually first up go across to Dr. Shenoy. Dr. Shenoy, what's going on? How do we explain to the rest of the country why Kerala suddenly is on top of the list?
There is no doubt that Kerala is on top of the list, as whatever figures you told. There is no doubt about it. How the pandemic spreads is basically based on how many susceptibles you have. In Kerala, what happened during the initial phase of the pandemic, the virus was contained in such a strict way. The lockdowns were very strict, containment zones were very strict. So virus could not get an opportunity to spread. So how can we know whether the virus has spread or not? One, the number of cases were less, and more importantly, the zero survey results have come, which very clearly show that Kerala's zero survey shows only 10% of the Kerala's population is affected versus many part of the country has 40 or 50%. Chennai has 50%. Tamil Nadu has around 25 to 30%. Average Indian zero survey is around 20%. So Kerala is at half the rate of the rest of the country. That is one of the major reasons why Kerala is seeing an upsurge now. There is no doubt that Kerala has a huge amount of urbanized community, unlike many of the northern states where after one city there is a lot of villages. In Kerala, it's like a single big city. From city to city, there is not much big gap. Like Delhi or Mumbai, Kerala is also like a city. In Delhi, the zero prevalence is something around 50 to 60%, while Kerala's all the cities are showing something around 10 to 12%, and maximum is in Cochin, where is it 14%. So it is very, very low when compared to the major other urbanized cities. That is one of the major reasons why Kerala is seeing a huge upsurge in cases. One reason. Second thing, I think, although the Chief Minister has said that we are going to build up the PCR number of cases, over last 10 days, number of PCR tests have not gone up. Still, it is around 20 to 25,000. We are hoping that PCR test is going to go up in another couple of weeks, because government is trying to do that. And over dependence on antigen test, which gives a lot of false positive and false negative, would have caused an upsurge. But major reason is definitely the initial severe containment Kerala has adopted, and delaying the peak is one of the reasons why Kerala is seeing an upsurge now. And in the month of December, there was an election in Kerala, and Christmas celebrations are very important in Kerala festival. So these two reasons also caused an upsurge.
Okay, thank you so much, for actually putting it in perspective. But obviously, this has become a very big concern to the point that even the Kerala IMA itself has written to the Chief Minister, seeking his attention to this matter. So then, what do we do? And do we need to relook at some of our policies, Mr. Shamsheer? That's the big question that everybody is asking right now. Do we need to go back and implement some of the rules again, shut down at least the schools until we get a handle on this situation?
You're propagating and you are exaggerating that Kerala is in our trouble. Actually, the pandemic, COVID is under control. We are increasing the tests day by day. That's why test positivities comes high. Now, compared to the last week, it is coming down. As per the Kerala is concerned, at the time of the beginning of COVID, as find out in January 13, for the last 12 months, our health frontline workers, doctors, health workers are all working in a very hard way. That's why the Kerala model has been appreciated by the whole world. Now somebody want to tarnish the Kerala government's image. That's why they're propagating lies. Anyhow, compared to the mortality rate in India, the entire India, that is 1.48. But in Kerala, it's only 0.4. We are the health doctors, the frontline workers in health sector, and the revenue, the police, the government, they are working very hard to contain this pandemic. Look, in some other states, it has come down due to herd immunity. But in Kerala, there is no herd immunity. We are increasing the testers. Due to that testers, we are finding out some positive cases. Anyhow, government is trying the level best to contain the corona. We hope, being an optimist, we hope that we can contain corona in a short way. So we hope so. But also, you have to find out the situation in Kerala. Kerala is a very thickly populated state compared to other states. A small state, a single terrain, people are living near. So there is no way to keep distance or social distancing in this state. But anyhow, we had got a good
Mr. Shamsheer, we seem to have lost that line with you. We're going to try and get you back. I understand that the point you're making, that even in comparison to a really high number of cases that Kerala would have seen earlier, it's not that high right now. But look at the rest of the country. The rest of the country has actually gotten to a better place, gotten to a better side. Now, I am also looking at certain examples where, because the state has reopened its schools from January 1st for class 10th and class 12 students, two instances which have happened just recently in the last few days. 148 students and 37 teachers of one school, 42 students and 42 teachers in another school have tested positive at one go. Events like this, Jomi Thomas, can make it complicated for any state, where you just need 2 or 3 super spreader events and the whole statistic goes upside down. Do we need to increase the surveillance? Is that something that needs to be stepped up? What's going on in various parts?
First of all, let me make it very clear that I am not an epidemiologist or I am not a medical expert. I am just a journalist. So it's not for me to say whether to increase the number of tests or not. But from my point of view, the issue is that see, this particular Kerala, the new Kerala model has to be deeply studied and analyzed. The point is that Kerala has the best healthcare system. Everyone accepts, even the current finance commission report also says Kerala's healthcare model has to be replicated in other states. That's the best in the country. And we are often compared with the European models. The point is that, see, what I think, the system is there, but there was some kind of a failure in the strategy. There is no systemic failure. There was a failure in the strategy, in the sense, initially itself, Kerala followed the COVID protocols very strictly. I should congratulate the government for that, particularly the health minister and the chief minister for taking the initiative. But now people are saying whether, that particular approach was correct or not, in the initial months itself. There we have to a certain extent, blame the central government also, that, the kind of approach as if, one model fits all states. That doesn't work, that we all know. See, another thing that Kerala, I think in the initial assessment, made a mistake that, I think there was some kind of an assessment, a mistake in the initial assessment that the state will be able to contain COVID, a pandemic like COVID, the way we managed Nipah. No, Nipah, we all know, whatever literature is available, we all know that it's a sporadic thing and it's limited to a particular area. Containment is easy. But in the case of a pandemic, that's not the thing. I think that there itself, the assessment, there was a mistake in the assessment. But I'm not questioning the sincerity of the government or the minister. They tried their best. But there are issues, when I say when the try to implement the protocols, Kerala is famous for people's participation. Whether people of Kerala, I would blame, no doubt I would blame the people of Kerala in, that participation was not enough, not up to the mark. When Shamsir was talking about the thickly populated and all, but when there is even when there is a lockdown, we are talking about wearing a mask, social distancing. I was in Kerala in the month of June. I saw many people wearing masks, but not to cover their face, their nose or mouth, but they were covering their neck. Then there are people, no social distancing at all. To take an example, even when these rates are so high, we see the opposition leader taking out a Kerala Yatra. And I think in a couple of days, we are going to see, the ruling parties, the CPM and CPI, are going to have the two political yatras from one corner to the other one end to the other. What does it mean? We are having so many, we are talking about, these are all simple violations of the COVID protocols. When we talk about density of population, these are all, I would say, to a certain extent, it's a kind of a man-made calamity. And another thing is that, but from a journalist point of view, I would say the communication strategy of the state was to a large extent wrong. Why I say this is because, this is a pandemic. We need to leave it to the experts to communicate. We always, I have learned in journalism classes that science communication is something very delicate, something has to be handled very carefully.
Okay.
This is not a political thing. This is a health issue where experts have to come in and explain to the people. But what happens is that politicians start explaining, what is happening, why it is happening. Again, I'm not questioning their sincerity. They may say they're all right-minded, good people. But the point is that they have to live in
Anger, I want to make some comments.
See, here, the point is that, again, when I say communication strategy, one failure I noted in that communication strategy was that, for example, even now, Mr. Shamsir is in a kind of denial mode as if, people are spreading lies.
Yes.
The issue is that, Kerala initially, even when politicians were communicating, we were kind of communicating an attitude of denial.
Okay, let me take that point because Mr. Shamsir wanted to respond to that, to the point, Mr. Shamsir, about some part of your strategy doesn't seem to have worked. Nobody is outright saying that the entire Kerala model it doesn't work or that it has become a failure. But let's admit today that Kerala is the outlier versus the other states. Your own Kerala Indian Medical Association has written to the Chief Minister saying you're not doing as many tests as you should have and you had targeted. You had set up a target. You're not even achieving those number of tests right now. The fact that we've opened up the schools and in school students are now testing positive in large numbers, that strategy needs to be relooked at. Now, these are just hard facts. This is not politics.
But my friend Jomi Thomas making such comments that politicians are illiterates regarding the pandemic situation. Why he's telling like that? Why he is telling like that? So he's asking who gave the right to politicians to make comments about the health. I'm asking Mr. Jomi very frankly, what is wrong with it? Our Chief Minister has made the press meet that boost up the morale of the entire community in Kerala. He addressed the press meets in the evening. That has boost up the morale. No. Anyhow, you are making unnecessary comments regarding the politician. You should apologize to that comments. Look, politicians know everything. Like journalists, also politicians know everything. But okay, leave it the topic. We can come to the issue.
Most of the things,
we can come to the issue. I am agreeing with you in regarding the wearing mask. That I'm agreeing with you. But in the entire part of the India, nobody is wearing mask. I'm not supporting the way of wearing mask. Yeah, you tell somebody is covering the neck. That I'm agreeing with you. But anyhow, when you go through, I'm staying in Kannur. From there, only 70 or 80 kilometers you can enter to Mangalore. You can see people are not using mask. While you're going to Mysore, people are not using masks. But anyhow, the government is trying their best to control the pandemic situation. We hope, we are being an optimist, we hope we can contain this corona situation.
Okay.
But I can say regarding my party, left is conducting a jada because we are in election. We are going to an election. We are bidding towards election.
Yeah, so before that, we have to get a handle on this
Yeah.
situation, Mr.
I'm agreeing
Shamsheed.
with you.
I think the point that was being made here was to say that you cannot be in denial of the fact that things are a little challenging right now, and you need to look at your own strategy. And if you're going to say, oh, we're doing everything right and there is nothing wrong, then you're not going to be able to fix the situation. That's the point that I think Mr. Thomas was also making. Let me quickly bring in George Kurian of the BJP as well. George Kurian, what do we need to quickly do? We cannot go into an election season when the cases are on the rise the way they are right now.
Yes, first they have to accept the reality. The 50% of the cases are in Kerala. And they are telling that the mortality rate is very less. But in Kerala, the mortality rate is 110 per million. In UP, it is 40. And the government has to accept that it is spreading in Kerala and take appropriate action. And they are blaming other people that they are spreading like that. It's a reality. It is increasing in Kerala, and 50% of cases are in Kerala. And let Shamsheed say that what they are going to do and what they have done, and what is the rate of this RT-PCR this test. Only antigen test was here in Kerala. These are the reasons, and they are telling that because of their chief minister, their leader, our Kerala chief minister, is very powerful man. That is why we can control the COVID in Kerala. But it is increasing, and they totally failed in controlling this government. And letting him say what they are going to do. How can they control it? And you see other states, it is already controlled. And it is 5,600, 6,000 in Kerala. And they are not telling anything. They are always blaming other people. And they have to take appropriate action. What is the action and what they are going to do?
Okay, Mr. Shamsheed, I know you want to respond to that, but before you do that, let me just quickly bring in Dr. Shenoy to one point that you raised. And Dr. Shenoy, the point was about herd immunity, or to say that in a lot of other states, we are inching closer to, that percentage of population being exposed to the infection, 40%, 50% in certain parts of Delhi. Is that also a factor that one must look at for Kerala?
Major factors is definitely Kerala's numbers of people who are infected and who are immune to the system is very low when compared to other parts of the country. See, Kerala's strategy was clear. Kerala decided to flatten the curve to such an extent that once the vaccine arrives. So, but what has happened is, of late, the vaccine distribution has not reached the 50% or 60% mark. It is going to take 4 to 6 months. All of us know it is going to take September, October to reach at least 30% to vaccinate Kerala's 30%, 40% of the population. But can we close down till that time? The answer is no. So what can we do? We have to go to basics, increase testing, increase tracing, and also increase the quarantining of the primary contacts. That's what Kerala has to stick to basics and go back. So what has happened is, initially Kerala was doing quarantining and isolating very well, and also the containment zones were very perfect. But of late, what has happened? See, with life, also livelihood also has to go on and on. So we cannot close down forever. So now, what has happened? We have opened up sectors, we have opened up schools, we have opened up theaters, which has definitely, and also the election season has caused a massive upsurge. Although Health Minister has told this, CM has told the same thing. The election season people were not obeying what Health Department was telling, which has led into the huge upsurge in the month of January. And I am hoping that in another couple of weeks, it will come down. So the basic and most important thing is, number of susceptibles are high, but the mingling of people is as good as in other part of the country.
Okay, that's an interesting point that you made, and so obviously that seems to play a role there. And in fact, let me take this point across to Mr. Kurian. Mr. Kurian, the argument also is that if you flatten the curve initially and you put everybody in a strict lockdown and you trace your cases and ensure that the number of cases is low and the infection doesn't spread, then at some point when you begin to open up, the number of cases will go up. The hope was by now more people will be getting the vaccine and that impact will show, and that isn't happening.
See, that was, they are manipulated the data. In that, in the first May in 2020, they declared that no case is there. At the same time, that day, 42 cases were there, as per ICMR data. They declared that no, but what is in Kerala, we win over the COVID. That manipulated, that data was manipulated. And now they cannot, because now in other places of India, COVID is decreasing. And in Kerala, it is increasing and spreading. And they are blaming other people. And what they are going to do, he can say, this Shamshir can say what they are going to do, what they have done. And the test positive rate is now 12% in Kerala. And India, it is
He's lying. He's lying. He's lying.
What they are telling, and lying, what is that?
Kerala is 5 to 6%, Mr. Gentleman, you are lying. You are lying.
You accept the reality, and the maximum number of COVID cases are in Kerala, and you are not accepting. You are telling that the world is lying, and you are telling the truth. And how many people are affecting this one? Are affected this one by?
In your UP, there is no testers. In your UP, no testers are taking place. In your Gujarat, no testers. In your Karnataka, no testers. But Kerala is doing tests.
The nation accepted.
And you are telling that RTP. Yeah, look, I am the person. I am an elected representative which affected the first corona.
Say the number here.
Okay. Let's hear what Mr. Shamshir has to say. Yes, and Shamshir.
Yeah, madam, I can say one thing. Government is doing the level best to control the corona. But unfortunately, the opposition is trying to spread corona. They are not following the lockdown rules at the time of lockdown. And also, George Kurian has made some comments. What our Prime Minister, living in a fantasy world, what he made a comments while declaring the lockdown in a 24 hours, within a 24 hours. He told the people that he will defeat like a Mahabharata Yuddha. Likewise, he will defeat corona. What happens?
He defeated.
Whether he has given enough time, breathing time.
Not.
I'm asking whether he had given breathing time to the migrant workers to go to their hometown. No. But I can say one thing very frankly. For the last 1 year, government is providing kits to the poor, kits to the needy. And also your anchor has asked whether we can go back to the lockdown. No, we can't go back to the lockdown. We can't shut down the shops, but we can control them. I'm asking this very simple question, direct question to the anchor and my fellow panelists, how the people will survive. If we shut down the shops, if we are not allowing the workers to work, how will they survive?
No, I don't think I am advocating that at all, Mr. Shamshir. We're not advocating going back into a lockdown at all, and I don't think that's something that we're going to advise on any of the other political parties or even experts are going to say so. We have been campaigning for lifting of the lockdown much before it actually happened. But the fact of the matter is we must be cognizant of the fact that the numbers are going up right now, and if in such a scenario, it's safe for students to be going to school. If for the rest of the year they've managed to not go to school and study, can we ensure that that continues? Or if we increase the testing, you have the highest so far, you're touching 90,000, 95,000. Do we need to take it beyond 1 lakh on a daily basis as well? Those are the questions the government needs to now consider.
Yeah, government is very, very positive. Government, as our CM has openly declared, is to reach 1 lakh RT-PCR test. But George Kurian has made comments that the government is doing only antigen tests. It's totally false. I am the person who belongs to a constituency where the first COVID positive affected. I'm the part of that constituency. Government has done RT-PCR test. Government has followed a strict quarantine measures.
How much?
Not only quarantine, and also the tracing of the patients. That has the model, that the Kerala model has done by our state. It has been appreciated by the entire world. Our health minister, our chief minister has been appreciated by the entire world. But now we are going to the election. We are going through the election. Some political parties want to tarnish the government's image. That's why they're propagating lies like this. We are controlling the death. We are controlling the patients. And also, we are doing our best.
I am
we are
out of
living in a federal
time.
system.
I'm out of time. Quick comment from Mr. Jomi Thomas before I wrap this up. Yes.
The point is that whether, Mr. Shamsir, was saying that I, consider politicians as illiterate. No, not at all. I have very high respect for even Mr. Pinarayi Vijayan. I consider him as one of the best chief ministers in certain respects. He is a very progressive person, no doubt about it. But the issue was about, the coming out of the denial mode. And don't make it an issue between politicians, political parties. Corona doesn't differentiate between CPM, CPI, Congress, or BJP. BJP people also equal share. I don't agree with most of the policies, by the Modi government, particularly in the case of Corona, where, when there is a National Center for Disease Control is there, you're asking ICMR to do all these things and creating a national model, for all the states to follow. See, Kerala has certain peculiarities one has to understand. Kerala is one state where, see, even today, the fatality rate is very low, thanks to the steps taken by the government. Compared to any state, George Kurian was talking about other states. But if you see the current economic survey also says first Kerala, then Telangana and Andhra Pradesh. These are the three states which could control the fatality rates. We are going by the number of cases only. That difference has to be made, and that is thanks to the Kerala model. But, other issues, why it is happening in Kerala, where the life expectancy rate is so high, but along with that, lifestyle diseases are also very high. People, I think the large number of diabetes patients, I think the maximum number is in Kerala. Correct. Another issue is that 10% of the allopathic medicines sold in the country is consumed by Keralites. That way, that shows how, the kind of ill health, of the people of Kerala.
Okay.
I don't think the entire blame is the government.
No, it's not. And I don't think anybody is sitting here and simply saying that the government is fully at fault. The situation in various states has changed. Each state's strategy was different. The point here is that at a time when you are seeing a slowdown in several other states, Kerala still is looking at a big challenge, and suddenly this challenge has become bigger than what it was earlier for them. So the government needs to now react quickly to it. It only takes a few super spreader examples and events to really add to your problem if you let your guard down, which is what we repeatedly say. Even as citizens, we cannot let our guard down until a large percentage of our population is vaccinated. And we are still several months away from that. And so we have to continue maintaining distance, wearing a mask, and following all the COVID protocols. Completely out of time. Thank you so much for the panelists who joined us to help us understand what's going on in Kerala.